topics like what is like, is it MS or a DNB? If you ask me the same question a few years before, my answer would have been totally different. Right now, both are equal. There is no difference, guys, when comparing to MS general surgery or DNB general surgery. So you can opt for any, whichever possible. So there are few subjective opinions from my side. So I just call it subjective because it changes from person to person. So I feel the hands-on are more in MS surgery when compared to DNB, because DNB courses are usually done in corporate or private setups. So that is one point I always want to tell. But assess the place. If you're able to get a DNB in a reputed institute, it is always better than getting an MS in a remote college where you have no idea how the academics, how the hands-on, whether you are taught by people who are like completely exposed. So always choose this. I always prefer getting a DNB in a reputed institute than getting an MS in a very remote colleges where you have no idea how the department, how the system functions there. So government MS is obviously a more than a private college. So because the private colleges have fee structures are very high, but in DNB the fee structures are capped. If you're going to do a DNB general surgery, so the fee structure I think around 1.2 lakhs per annum, and you get a good amount of stipend based on the state medical colleges. So always look for bond and financial aspects as well while choosing this course. I will tell about this bond and financial aspects in the upcoming slides, because currently all the students, especially the MBBS students and interns, are have a very clarity of thought regarding this bond and financial aspect. We'll discuss that in the upcoming slides. So there's another subjective opinion like this. I always feel like DNB residents are much read than MS resident, because the DNB program is more of an academically oriented. Of course, it doesn't mean they don't have any kind of surgical skill. The surgical exposure are also good. When comparing to MS, the DNB surgical residents have a great exposure to the super specialty courses, which I often see even in current institute. I always feel that DNB residents in Apollo Lucknow are having a great exposure to super specialty departments. So there are a few pros and cons of MS and DNB. So my final take will be both are good. So you won't regret if you take any of this. So again, a very important question. So why you want to crack my head by taking an 3 years MS and then thinking whether to take an MCH or not? And if you want to take an MCH, I have to put another some amount of time and energy to get a course of my choice. Why can't I take a general, the straight 6 years course? That will be a cakewalk, right? Because there's only one exam. I clear that exam. I taken a course of my choice in 6 years. Then that's it. For 6 years, I'll be there. And as I come out, I'll come out as a super specialist. Won't that suffice for me? Guys, you are right. You are right in a certain way, actually. So in India, we have a 6 years course for a neurosurgery, pediatric surgery, plastics. If I'm not, I think CTVS also provides a 6 years course. Yes, of course, it provides a better training, 6 years at a stretch. There are few, I don't take disadvantages. There are few points you should think before taking this 6 years course. Like, you can't change in the midway, because those who are taking this 6 years course are MBBS students. Their exposure in super special departments are very, very minimal during our internship. Right? We have no idea how the super special department works. I have no idea. While doing my internship in a Chengalpet Medical College, I have no idea how the plastic department runs. Even though we have a dedicated plastic department there, because we are not posted there, and we are not posted in the neurosurgery department either. So you can't change in the midway. Our exposure as an MBBS student for this super specialty course is very less. So if you take any course because of your fascination or because of your motivation, at the end of 3 to 4 months itself, you start regretting it, guys. So that is a very, very important thing, because once you leave the course, there's no comeback actually. So that's a problem in 6 years course. Because if you've taken a DNB seat and you left it, I think you can't write it for a good number of years. I'm not very sure it's 3 or 4 years, but you can't write the DNB course for a good number of years once you left the seat. So can't change in the midway. That's one of the very important disadvantage in 6 years course. And the general surgery exposure is less. Yes, that is that. You see, all the proponents of 6 years course used to tell we have a general surgery course that runs for 1 or 2 years. We do work like an residence of a general surgery. Yes, I know the 6 years course also offers a general surgery exposure, but how much it is taken by the residents, importantly, that matters. Because I have seen few of my 6 years residents, they are taking this general surgery exposures very lightly. They saying that no, my exposure is neurosurgery, man. Why the heck I want to do this kind of dressings, all those stuff? I don't want to do that, guys. The general surgery is the base for everything, not only for surgical oncology, GA surgery, or urology, even for neurosurgery, plastic, pediatric surgery, patient assessment, pre-op management, post-op management, wound care. All these are a basic line on which the super specialty foundation are laid. So if you start assuming general surgery is nothing, definitely your foundation won't be that much strong. So that's the main reason there's a high drop rate, because you can't change the field. So what can we do? So like you have told everything about this. So what's your final take-home message? Whether should I take this or not? 6 years course after completing my MBBS. My humble request will be like, you assess the field, guys. If you're 200% sure that this is the field you want to do it for a lifetime, then take it. But 90% of us will not have this kind of confidence to take that particular step. So what we should do then? Just do an observership in that particular field for 2 months. Just to go to a nearby neurosurgery department, ask him, so I just want to observe what is happening here. I will be here for next 1 or 2 months. Let me see how the department runs. Because going for 1 or 2 days not going to change anything. Just be there at least for 2 months. Just see how the patient get admitted, gets operated, post-op, recovery, complications, how it happens, how the timeline for them. So if you observe all these things, you will get a good idea whether you can take this course for 6 years at a stretch, because that will give you a better idea whether you are capable, your personality suits this 6 year super specialty course or not. So that's my take home on this. So Sally, you're confused of so much. There are so many options like MS, MCH, fellowships after completing that. My financials are not that good. After completing my MS general surgery, will I able to thrive with that, or MCH is necessary for it? So guys, the answer depends on where you want to practice, which are tier 1, tier 2, tier 3 cities. There is no doubt the MCH overshadows right now. The trend is towards super specialty, but most of the areas are right now a gray zone, guys. The concepts are gradually changing. My personal request will be, after completing your MCH, even during your MCH, you will be posted in your super specialty departments. Just see which fascinates you, which you want to acquire. Or after completing, you think about yourself, what you want to do in next 5 or 10 years life, where you can see escalation and progress. And if you feel that particular subject offers an MCH, just go for it. If that particular field offers a fellowship, you can definitely go for it. There is no doubt on that. But as I said previously, don't run behind the fellowships or MCH blindly because your colleague is doing that. Because in that way, you are going to spend totally a 12 or 13 years of life, starting from MBBS till completing your MCH, with all kind of ups and downs in the financial, emotional, and social aspects. So just running behind any kind of a super specialty course will never going to fetch anything. You will end up in spoiling both your personal life as well as your personal life. At the end of, you'll say that I would have not done this, I would have done that. So completing MCMS is more than sufficient to thrive at this point of time, provided where you want to settle. And if your clear intent is that I just want to take an MCH course and my subject of interest is this, and this provides an MCH, please go for it, guys. There is no doubt. But general surgeon got a huge patient boost. They can have a huge patient practice with that as itself. There's no doubt in that. The government institutes are private, so everyone will get a clear-cut idea that obviously any students who are opting for a general surgery will definitely take in a government or institutes, and obviously private is not anything we should definitely avoid. So the days are changing. There's a very beautiful story, guys. Not a story, there's a kind of experience which I had a few months before in AIIMS Patna with one of my colleagues there. So back then, like in 6 or 7 years before, while myself and my colleagues are taking a seat for general surgery, so the only thought process we had is like, we want to take in a state government medical college for MS general surgery. That's it. Because the hands-on will be good there, and the exposure will be great there. So that's the reason. We don't want to prefer any institutes like All India Institute of Medical Sciences or PGH Chandigarh or JIPMER, because all the institutes, the surgical hands-on will be less. This was taught to us like it was quite true as well. When comparing to state medical colleges, the institute provide less hands-on. There's no doubt on that. So this was our intention, and everyone who gets a good rank through AIIMS or NEET goes to prefer a college of state, the state medical colleges or other state-based medical colleges. That's what our intention was. We had very clarity of thought. But right now, the MBBS students, interns, or the PG aspirants have a very clarity of thought that, sir, so I know that times are changing right now. I know after completing my MS general surgery, I have an option that 50% there's a chance that I have to do my MCH. So keeping in that mind, so there are few variables I want to see before selecting a college. I asked, what are the variables, guys? You just tell me that. So he told me like, so I want a good pay, because that matters in at this point of time. So the pay, it takes care of my family and myself. So they can have this long run, because it's not a sprint race where you can just run and take a nap. It's a kind of a marathon. So I just want a good pace. So I don't want any bond. I was like fascinated. Oh, great. Because like a bond also constrains yourself by doing any kind of super specialty or any fellowships per se. So I don't want any bonds. And I want a good work-life balance with an appropriate surgical exposure. So I don't want to do at least a 10 to 12 emergency laparoscopies in a day. If it is 4 to 5, I'm happy with that. But I want a good work-life balance. So these three things I always calculate, and I always want to take an area where there is no bond and pace is good and the surgical exposure is adequate. It's not necessary, it has to be very hectic and mentally exhausting. If it is adequate, at least in the first year, I will put all my effort. In the second year, I'll get free time. In third year, I'll get a more time for academics. And at the same time, I can prepare for my MCH as well. So I was fascinated by this guy's talk, and like, what kind of clarity of thought right now the MBBS students and the interns are having and the PG aspirants are having right now. Initially, I thought this guy is doing a stupidity, because by getting a good rank, he would have taken a best state medical colleges. Then after listening to his talk, I was like, he made a calculated decision, which is in a very educated. So I was like, so happy for him. Like, so right now, the guys or girls are very calculated. They know what they are going for. So taking government or institute, it's up to you guys. So both are good. You just take a calculated decisions which you want to practice. So that will give you good results. So this is completely subjective thought. Good if it is from government more than private, and no need to worry, guys. Suppose if you are doing it from a private medical colleges, no need to worry. If everything will get neutralized at MCH level. So government or private or institute, what matters the most is the mentors. In surgery, everything depends on the mentors. So if the mentors are good, you will definitely have a great surgical exposure. So the same thing, like which college to prefer, a state or primary institute or private, this shuffles and goes on. The Subject Calicut, SMS Jaipur, UCMS. So it's totally subjective. You decide among yourself what you want to do, a state government medical college or a primary institutes. So take a calculated decision, and both are equally good. One provides in a good hands-on exposure, another provides a good hands-on exposure and the other allied features. So both are equally good, doctors. So like, it's a totally exhaustive, and I had taken almost like 30 minutes. I think we'll wind it up soon. So onnume purile, doctor. Like, this is a very long session, and how to take a decision. So guys, like these are the few boxes which I want you to take, whether you choose any colleges for any course. What is the location? What is the stipend? What is the bond? What is the hands-on? What is academics there? And what the past residents are doing right now. So you just assess all these 5 boxes and tick all these boxes. So it is not possible for you to tick each and every box for a single college. You might miss some, you might have few. So whichever fills the most, just go for it. That will be a better option, because always there's a positives and downs in taking a college. There are few colleges that are better in good something, won't be better in some other things. So if there's a good hands-on exposure, you may not have a good work-life balance. If there's a good work-life balance, your hands-on exposure will be very much lesser. So you have to take a calculated decision according to that. But make sure these 5 boxes are ticked as much as possible before taking any college for the choice.